Tracy with the Oasis for Natural Healing. So, we're going to be talking about parasites, personality, and poop. So, it's the full moon. I don't know about you, but today has been kind of a little bit of a goofy day, and I'm not the only one that's having an off day. Some of my patients are, some of my friends are, some of my colleagues are, and it's just been a really goofy day. You know, people are a little bit irritable. Um, they're not their normal self and they're having some anxiety. They're not acting the way they normally would. And I really couldn't figure out what the heck was going on. I had some instances in my office today. I'm not going to get into details. And, people are just a little bit more on edge. I've noticed that with, like I said, some family, some friends, some, and it's just kind of an odd day. And then I forgot that it is coming up to be the full moon. So I thought, oh, what a better time than now to talk about parasites. So we're going to get into parasites, personalities, and poop. And most people have parasites, and they can cause a lot of issues. They can cause anxiety, they can cause depression, they can cause insomnia. You can wind up having schizophrenia even from parasites. Um, you can wind up having sinus infection, like chronic sinus infections, or bloody noses, or even headaches. Even seizures can actually be from parasites. And it's kind of funny because there's actually research articles on this. And yet, the Western medicine, in a lot of cases, denies or doesn't look at these as the underlying cause of why people have their symptoms. So, you go see a psychiatrist, they turn around and you take these like psych evaluation tests. And depending on your score, it's called the GA, General Anxiety Disorder, GAD, and there's either a 7 or a 9. So it's a 7 questionnaire to diagnose you with anxiety, or a 9 questionnaire to diagnose you with anxiety. This is what and so if you, just depending on your score on them, then if you score X amount, then you have mild. If you score a certain amount, then you have moderate. If you score, X amount, then you have severe anxiety. And then from there, then we give you a pill, and we give you an anti-anxiety medication, you know, um, which has its own set of side effects. And some of them can be pretty severe. Some of the anxiety meds can actually be very addicting too, and habit forming. Sometimes they can cause, so you take a pill for anxiety, and it can cause memory issues, or it can lead to insomnia, or it can cause worsening of depression, or it can cause suicidal thoughts or behaviors. And if these occur, then please contact your doctor right away. I'm sure you've heard of like all those like those infomercials and stuff like that. Well, yeah, if I have suicidal ideations from this medication, and heaven forbid that somebody acted on them, and you tried committing suicide, too late there, bud. So is that really the route that you kind of want to go? Or would you kind of want to find out, well, great, I have anxiety. I might be diagnosed with anxiety, but why? What's the underlying cause? Excuse me. I've been talking all day. So what's the underlying cause of why do you have anxiety? And I'm sure some of you guys have heard this before, or maybe you guys have experienced that. So you go to the doctor, you have all these symptoms. I can't sleep. I'm anxious. I'm depressed. I have racing thoughts. Can you do some blood work on me? Blood work comes back, and the doctor goes, blood work's fine. It's all in your head, or it is just anxiety. Let's give you a pill. Problem is that when we do blood work, we're comparing your blood work to everybody else's. It's an average. And just because it's normal for one person does not mean it's normal for you. And quite honestly, they keep changing the range. It's actually, I believe it's now even larger than what it used to be. So like let's take thyroid. I've talked about this before. I'm going to talk about it again. So TSH levels, for instance, zero point 0.4 to 4, well, it was 4.5. And I think on some, depending on where you go, they've increased it to like 5.1 or something like that. Think about it, zero point 0.4 to 4.5, even if it was if it stayed at 4.5, that's still a huge range. And as long as you fit somewhere in the middle, I deem you normal. Okay? So you could be 3.6. You're in the zero point 0.4 to 4.5 range, you're normal. Might be on the high end of normal, but you're still normal. Or you could be 2.0, right smack dab in the middle. And you have all these symptoms. Maybe even though you're normal, maybe your body isn't happy there. Not only that, but when you get blood work and you get just a TSH level, because that's what most physicians do, we just order TSH levels. When we just order a TSH level, guess what? We're not even measuring the thyroid gland. We're measuring the pituitary gland. The pituitary gland actually produces TSH. TSH stands for thyroid stimulating hormone. So if it's a hormone to stimulate the thyroid, it can't be produced by the thyroid. It's got to be produced by another gland to stimulate the thyroid. But yet, that's all we measure. How well the thyroid is functioning is based off of that TSH level. So, in order to actually get a really good idea, you have to do several other labs, not just the TSH level, like free T4, free T3 total, reverse T3, parathyroid hormones. I would be doing all of those to get like a full idea. And there's even some other ones that you could get done too. But again, even if you're in the normal range, doesn't mean it's normal for your body. Okay. And so my point being is that you can have normal lab levels. Doctor says your labs are normal. Here, have a pill. Okay. So, and even if let's say your thyroid levels were off, they're going to just give you medications for for your thyroid. Holistic practitioners, Eastern medicine, and what I do, it begs the question of, well, great, but why is that thyroid not functioning optimally? So yeah, you might have off labs, but why? Okay. Oh, well, it's an autoimmune. Okay. But why? What's causing it? And most of the time, yes, it could be genes and things like that. And what people don't realize is that even that can help. That can be helped. Even if you have genetic material or your genes are there's that can actually be helped too, believe it or not, holistically. But most of the time, it's usually several different stressors. Okay. And we're going to talk about parasites tonight. That is one of the most common stressors. There's other ones, but tonight we're going to be talking about parasites. So they can be microscopic, waterborne. You're not going to see these with the naked eye. Okay. So they're usually one-celled single organisms. A lot of times they're waterborne. What does that mean? It means if you go swimming in a lake, you go swimming in an ocean. Now you can get larger parasites from that too. Um, or even our tap water has parasites. Okay. So you can get waterborne parasites from that. Neti pot nasal washes using tap water. You're shoving parasites right up to your sinuses, close to your brain. You can inhale parasites. Animal feces carry parasites. So if you're cleaning up poop, not to saying to get rid of Fido or Fifi, but you have to know this. Animals get parasite cleanse. You give deworming to animals all the time. Why are we not taking dewormers for ourselves? Okay. So you can inhale parasites, which means that they can get up to your sinuses. You've heard about that, pregnant moms and cats cleaning cat litter. Shouldn't be doing it because you can get a microscopic toxoplasmosis, which can be bad for the baby and for mom. That's not the only place that you can get toxoplasmosis. So, but guess what? If you're inhaling it, it doesn't just go up to the brain, you can actually inhale it into your lungs. Yeah, you can. They can stay living in your sinuses, causing a lot of asthma problems, nosebleeds, chronic sinusitis, headaches, yeah, sinus pressure, sinus congestion, postnasal drip. So you can get parasites from eating sushi or undercooked meat. Who likes bloody red rare steaks? It's good, right? But it's also undercooked. So this is where you can get parasites from. All right. And you can get the large ones too. Who likes bacon? I like bacon. All right. So I try to get the nitrate free, and I try to make sure that the pigs are, um, no antibiotics, no hormones, things like that. But I like bacon. But who likes theirs little kind of on the soft side, not super crispy? Guess what? Slightly undercooked. And pork parasites are kind of hard to get rid of. Okay. So sushi, undercooked meat, let's see, you can get it from the soil. So if you like to garden, there's parasites in the soil too. You can get parasites from bug bites. So all mosquitoes. Don't just think that tapeworms and heartworms can be given to your dog just from mosquito bites. Guess who also can get tapeworms and heartworms and other things? Humans. Okay. So mosquito bites, spider bites, tick bites. Okay. Any biting insect can have parasites and can give that to us. All right. So you can have large parasites, which sometimes when we kill them off, you can see them in your stool. So you can see it in your poop. And we actually do the largest parasitic cleanse in our office, and whoever poops out the biggest worm for that month, and they send me a picture that I can use, then you get a prize at the end of the month. So we do biggest parasite challenges because I want to show people that this is really a real thing. And pretty much everybody has parasites. And, somebody asked me once, well, don't we need a small amount of parasites? Parasites can actually be slightly beneficial when our bodies are full of toxins. Actually, parasites actually will act as what we call a chelator. They absorb toxins, they absorb heavy metals, they absorb heavy chemicals when our body is very, very polluted. So, in that way, they're actually somewhat beneficial. Okay. You get rid of the toxins and the heavy metals, you don't need the parasites. Our bodies can actually fight it off. And you're probably always going to have like a small amount of parasites. It's just when they become overpopulated and they start having a breeding party in your body and they go goofy and they get to be an over amount in your body, that's when they can cause disease and problems and symptoms and whatnot. So but yeah, and usually whenever somebody has parasites, they always have heavy metals. They go hand in hand. Parasites and heavy metals go hand in hand. So it's like, which came first, the chicken or the egg? And usually heavy metals kind of like break down barriers, and toxins break down barriers, and they can throw off pH balances and things like that, which allow parasites to settle in. And then parasites can actually then turn around and cause personality changes in people. Okay, so personality disorders in kids. So if you have a really difficult kid and you don't know where all of a sudden their behavioral changes come from, guess what? Could be parasites. Yeah, that's right. Kids can have parasites. Kids can be born with parasites. Just like mom dogs and horses and things like that can pass parasites to their infants in utero, humans can do the same thing. So yes, our infants can be born with parasites. So colicky babies and things like that. So fussy babies, babies that can't seem to tolerate milk and stuff like that, first off, it's usually that the babies can it's not that they can't tolerate milk, it's that a lot of times mom is not producing a good amount of digestive enzymes, and most people from today's food that we eat throws off our digestive system. Our body cannot produce enough digestive enzymes. Digestive enzymes are passed via our breast milk to the infant. So that way, then the infant, because the infant isn't really born with too many digestive enzymes, if any at all, and the spleen, which the digestive enzymes are actually produced by that, is not able to produce the digestive enzymes that we need until you're, I forgot how old, but newborns don't have any digestive enzymes. They actually require digestive enzymes from their mom and from the breast milk. And if mom doesn't have the proper amount of digestive enzymes, then the baby can't digest breast milk properly. A lot of times we give the mom who's nursing good digestive enzymes. We help balance out her gut. Then all of a sudden the baby can actually tolerate breast milk again. So, and then they're not so fussy, they're not so colicky, they're not so gassy, they're not so bloating because we're actually giving the proper nutrients for mom. Then mom can pass out the proper nutrients through her milk to her baby. But parasites can actually also cause a lot of gas, a lot of bloating, and things like that. And yes, babies can have them in their digestive tract. So, and usually we can help with mom and baby getting rid of parasites very, very naturally, very safe, and very effective. So that way, baby and mom can actually feel better and get the proper amount of sleep. So, but personality changes can actually be a sign of parasites. Okay. Um, and then problems with digestive stuff. So let's talk about poop. I had a patient. So most people think that if you have diarrhea issues, that that's going to be a sign of parasites, but it can actually be from constipation can actually be a sign of a parasitic infestation because you can have so many parasites and they can actually constrict your intestines from gently moving. So it's called peristalsis. And it's like your intestines kind of do like gentle wave like motions to help gently push stool or feces through the tract so you can excrete it. Well, parasites can get so big and so bound up in your intestines or in the lining of your intestines that they almost constrict that movement. And so then people don't have that peristalsis to gently push stool through the tract, and then they become constipated and bound up. And actually that happened with I had he was he 4 or 5? Now I can't remember. I had a 4 or 5-year-old patient that would come in that saw me. Poor mom didn't know exactly what to do at the time. And this poor kid, he had so many he actually was in the ER almost every single month, and he would have to get enemas. 4 or 5 years old. He was already on Colace and Dulcolax, and he like uh Fiber One stuff, and I forgot what else he was on, but he would have to go into the ER. This was years ago. And he would have to go into the ER and get an enema. 4 or 5 years old, an enema already at that age. And he already had colonoscopies done and nothing. They couldn't find out why he was having his issues. And so mom, out of desperation, she kind of, thought what I did was a little bit wonky and wasn't really quite sure, didn't really know if she fully believed in what I do. And it's a lot of my patients, and I don't blame them. If you had talked to me about 15 years ago and you told me that I was going to be doing this, as a cardiac ICU nurse at the time, I would have looked at you like, you got to be kidding me. Me doing this? I would have thought that you were what were you smoking? Because I would have wanted some, right? Type of attitude. Because I thought this was a whole bunch of hocus pocus and stuff like that. And um I really didn't. believe in what I'm doing now back then. And so she really, and I can't blame her, she really didn't fully believe in what I did, but she was desperate. She didn't know what else to do for her son. It broke her heart to have him have an enema, and he didn't want to go into the hospital anymore and get these done, and I can't blame him. So she brought me in. So she brought him in so I could do some muscle testing on him. So I did, and he was able to pinpoint exactly where it hurt on his abdomen. So I muscle tested that, and I'm like, he's got parasites. Again, she was a little skeptical. There was a way for us to find out this was all non-invasive. So 4 or 5 year old didn't mind coming in because this was non-invasive. I wasn't poking, I wasn't prodding him. He thought this was kind of fun, and he was actually one of my favorite patients. Um, and he thought this was fun. And so I would muscle test him. He'd take some supplements, no big deal. Some of them weren't exactly the best tasting, but he was a good sport about it. And it took me a while, so this is not like an overnight fix, well, and quite honestly, medications aren't an overnight fix either. They just mask symptoms so you think you're better, in a short period of time. No, because if I ripped off the band-aid, you'd start bleeding all over again. That's basically what medications do. So they just cover up symptoms. They don't really cure anything. Okay. So, um, so true healing can take a little bit. So it took about, let's see, 6 to 8 months for it to fully be resolved. Now, mind you, it didn't take him that long to start feeling better. Was he 100% better? No, but he was better, and he was able to go to the bathroom a little bit more frequently. So instead of not going to the bathroom, because he'd go for weeks without pooping. So now we were going to the bathroom a couple times a week, and that happened within a couple months, like a month or two, where he was going to the bathroom a couple times a week. So we were able to avoid him going to the ER, which was fantastic. He was all excited about that. He still had some abdominal pain, but it wasn't as bad. And then finally, around this, like I said, around the 6 or 8 month mark, this was a couple years ago. So don't quote me on this, but it was about 6 or 8 months into it. Finally, he actually pooped out some parasites. And his mom sent me a picture. I've shown him to him on Facebook before. And no more issues going to the bathroom, no more abdominal pain. He never had to go back into the ER from my understanding. And he was with me for a little bit longer, and then they moved. So, but it was such a great honor and pleasure to be able to help this 4 or 5 year old boy not have to go get enemas, not have to go into the ER, not have to go get prodded and tested and all this other stuff, get colonoscopies. Can you imagine bringing, your poor kid is not feeling well, and you're having to take time off of work or whatever to bring your kid into the ER to get colonoscopies, to get enemas all the time, always worried that your kid isn't feeling better. And now that we got to the underlying cause, now they're doing really good. And that's what it's really about, getting to the root cause of why you have your symptoms. So, parasite infestation doesn't just have to be causing diarrhea. It can actually cause constipation too. And you might be asking me, okay, well, if he had colonoscopies before, why didn't they see it on the colonoscopy? And that's a very good question. So you have to understand so I'm going to try to explain this. So, okay. So if you, not to sound goofy, so this is your intestine, right? So the camera's going in this way. This is getting graphic, but so the camera's going in this way. So this is your intestine. Now, if I take this hand, let's say this your belly button's here. Okay. So you have multiple layers, right? I don't know if you can see this. So you have so the intestine is attached to your abdominal lining. Okay. So you have multiple layers of tissue, right? So this is the inside of your intestine. Your intestine is attached to your abdominal lining. Otherwise, it'd be sloshing all around on the inside of your abdomen. Okay. So this is the outside. This is your belly button. This is like what you see when you look in the mirror at your abdomen. So your belly button's here, and your intestines are attached here. So when we do a colonoscopy, we're only looking through this. and you have all these layers, right? You have all these layers, and these parasites can actually burrow between the layers, if that makes sense. So when you do a colonoscopy, if they're alive, they're not gonna you're not gonna be able to see them a lot of times. They can be burrowed into deeper into the tissue, and you might not see them. This is like why, kids, that have pinworms, if you've ever heard to that you put tape on the baby's butt at night, and then you wake up and if you see pinworms on the tape, then you know that they have pinworms for real. But why doesn't it show up in stool samples? Why wouldn't the doctor just say, "Well, bring in a stool sample," or "Let's do a colonoscopy on the kid"? Because we know that it's not always accurate because they can go burrowing into tissue, and parasites are very active at night. So, and if I do a stool sample, if you unless you're actively killing off the parasites, you might not have it in the stool sample because they're going to be alive. They're not going to be in your stool, they're going to be in your intestinal lining. So just because your stool samples are negative doesn't mean you don't have parasites. So it's an inadequate form of testing. And 99.9% of the human population has parasites. And in a lot of other countries, they do parasitic cleanses on a routine basis. We just don't do it in the Western Hemisphere. And I'm not quite sure why. More and more people are starting to wake up to that idea, but we're still not, Western culture is not fully convinced that you have parasites when in fact you do. Everybody should be at least doing a parasitic cleanse 1 to 2 times a year indefinitely, along with a heavy metal detox. This is maintenance and preventative. I don't know why we don't do that as part of our routine healthcare management, and it should be. So, here at the Oasis for Natural Healing, we use a technique called quantum nutrition testing to test to see what supplements your body specifically needs. Sure, you can go ahead and things like clove, wormwood, black walnut, garlic, myrrh can be really good too. So there's a whole bunch of different herbs out there to help with parasites. Sometimes you need combinations, especially for things like ropeworm. Ropeworm are very, very large parasites, and they're a little bit of a tricky little sucker to get rid of. And sometimes you need combinations of herbs. And that's what I like with quantum nutrition testing because we can specifically find out exactly what supplements your body specifically needs. And it literally takes the guesswork out. I've been doing this muscle testing for 8 years now. I am certified in several different techniques and have kind of hodgepodged them all into one. And yeah, and the results just they're pretty darn amazing. I don't look back on moving from Western medicine to Eastern medicine at all. I absolutely love what I'm doing. I was a cardiac ICU nurse for 13, 14 years since 2004. I became a family nurse practitioner in 2017, but I've been doing holistic health alternative medicine since 2015. So yeah, and we're going on almost 9 years now. So, and I've never looked back. I love doing this because I know that this makes a really big difference. So if you are suffering or and you're tired of just putting band-aids on, you're tired of from masking your symptoms and you really want to get to the root cause. And again, with quantum new testing, we can do this near or far away. If you really want to get to the root cause, then give us a call. We have a couple more days. We have about a week left of in January. Don't forget, we have a special on our um, consultation. Our consultation is 2 appointments, an hour each. That's an hour long on each appointment, 2 hours of professional time to really listen to your concerns, really get to the root cause of why you have your symptoms. And then we put together a report and we go over in depth, answer all of your questions on the second appointment. So that's 2 appointments, an hour each long. Most of the It's normally 250 for both of the appointments in total. This month, it's 149. And HSA and FSA accounts do pay for office visits and supplements. This can be done in person or long distance. So whether you live close by and you live in the Chicagoland area, great. Would love to see you in person. If you don't, and you want help getting to the root cause of why you have your symptoms, if your doctor has not been able to find out why you have your symptoms, or you're just tired of being on medication and want to get to the root cause, give us a call. 708-554-6730. Thank you. Wonderful night, guys. Happy January and happy full moon.